Make sure you're watching your signs and symptoms of a transfusion reaction. This is pain and oozing from the IV site, chest pain, itching, fever, which is a rise of 1 degree Celsius or more, chills, rash, back pain, anything like that. I usually tell my patients, if you are feeling off at all, if there's anything funky going on, please call me. I would much rather they call me in and it turns out to not be related to the blood than they don't call me in because they don't think it's a big deal. If they do call you in and say that they're having itching or they have a rash or chills or anything like that, ask them if it's new for them. If they have had a rash since they got there and it's that same rash, it is not a transfusion reaction. So please use your judgment on that. If you suspect a transfusion reaction and you select yes in Bridge when it asks you if there was a reaction noted, it's going to give you these steps in Bridge, tell you exactly what to do. You need to stop the transfusion immediately. You're going to notify blood bank and the provider. If that blood is to be restarted, the provider and the blood bank pathologist have to give the okay on it. So if you call the provider and you say, hey, my patient's temperature has gone up 1.2 degrees Celsius, I'm concerned they might be having a reaction, and the provider says, oh, it's fine, go ahead and give them some Tylenol and keep the transfusion going. You still have to call the blood bank pathologist. If you call and notify blood bank and the pathologist in blood bank says, no, absolutely not, do not restart that blood, you cannot restart the blood. It requires both of them to be on board. You're going to disconnect the blood administration set and put a sterile cap on the end of the tubing. You're going to start a new bag of normal saline with new primary tubing. You're going to obtain and document vital signs, administer supportive therapies ordered, so oxygen, medications, IV fluids. Recheck the patient identification. You're going to redo that verification with a buddy. Then you're going to order a transfusion reaction workup. This will require labs to be drawn, and you need to make sure that the first voided urine specimen is sent to the lab for free hemoglobin. Put a sign on the door, put a sign on the toilet, whatever you need to do, make sure that that first voided urine is sent to the lab. Then you need to walk the used blood administration set. This includes the blood, the tubing, and the saline down to the blood bank. Do not tube it down. It needs to physically be walked down. Any member of the healthcare team can walk the blood down. Again, if the physician requests and the pathologist has given approval, a blood transfusion may be restarted after signs or symptoms of a reaction. Nursing needs to write a physician order that says may resume/continue transfusion. The order needs to include the name of the physician and the pathologist and blood bank giving permission to resume or restart the transfusion. Your documentation will include signs and symptoms noted, blood components administered, amount infused, the time the physician and blood bank was notified, the recheck between the patient and the component, and the treatment administered to the patient. So over the next several slides, I'm going to show you what it looks like when you have a reaction that you document in Bridge. So you'll click End Transfusion. From there, you're going to scan the 2 barcodes on the blood and move to the next screen, enter the amount infused, and then document that a reaction occurred. So once you've selected that a reaction occurred and how much was infused and click Continue, it's going to ask you to select the clinical signs and symptoms. So you need to select whatever symptoms your patient has going on that indicates a blood transfusion reaction. When you click Continue from that screen, it's going to bring you to this reaction instruction screen, and it walks you step by step through exactly what to do to manage that reaction. Again, you're going to stop the transfusion, maintain IV access, hang normal saline with new tubing, recheck your vital signs, perform a clerical check to assure that the blood component is being given to the right patient, so do your review of the component and the transfusion record and your patient again. Notify the patient's physician and supervisor immediately. Call blood bank immediately, talk to the pathologist. Complete the reaction signs and symptoms section. The nurse will order a transfusion reaction workup. Transfusion reaction report will print to blood bank. You're going to return the blood unit, attach tubing and solutions to the blood bank in a biohazard bag. Do not use the pneumatic tube system. Collection performed by phlebotomist, and then testing is performed. Nurse to collect the urine specimen. From there, you'll click Continue. The next screen is going to have you check to state that you completed all of those transfusion reaction steps. Anytime you are done using Bridge for the time being, please click the X button in the upper right-hand corner, that red X, to close out of the window. If you leave that tab open, then every time you enter Bridge, it's going to open a new tab and you're going to bog the system down. It's going to have an extra login for you that it doesn't need. So once you finish documenting in Bridge for that section, go ahead and X out. So you'll go in, you'll start your transfusion, you'll document your initial vital signs. When you finish all of that and actually start the transfusion, you're going to click the X button to close the whole window. When you need to go back in to do your 15-minute vital signs, you're going to go back into Bridge. You'll enter those vital signs. You will then click the X button to close the window again, and so on. Please do not leave more than one Bridge window open. It is going to cause the system to bog down. There are a couple of specific types of transfusion reactions that I want to draw your attention to. The first is transfusion-related acute lung injury, or TRALI. This occurs in about 1 out of 5,000 transfusions and is the leading cause of transfusion-related death. It can occur during the transfusion and up to 6 hours after. It's thought to be related to donor leukocyte antibodies reacting with the recipient white blood cells in the capillaries of the lungs. It is more common following transfusion of blood products containing large amounts of plasma, but it can occur following any transfusion. The second type of reaction I want to draw your attention to is transfusion-associated circulatory overload, or TACO. The American Association of Blood Banks, AABB, has recently focused increased attention on the recognition of transfusion-associated circulatory overload, or TACO, in patients receiving blood products. TACO is a leading cause of transfusion-related morbidity and mortality. It's very important that you identify your patients at risk of TACO prior to transfusion and recognize the signs and symptoms of TACO during and after the transfusion. It's also important to distinguish TACO from other reactions and related conditions. This is especially important to distinguish it from TRALI. TACO responds to diuretics, TRALI does not. It's recommended to transfuse patients at risk for TACO slowly and carefully monitor them for signs and symptoms of TACO. So your patients who have congestive heart failure, who have elevated BNP, anything like that, they're going to be at a higher risk for TACO. They need to be transfused slowly. So the compare and contrast here for TRALI versus TACO, they both have acute dyspnea and bilateral diffuse infiltrates on chest x-rays. But TRALI is non-cardiogenic pulmonary edema. The temperature goes up, blood pressure goes down, white blood cells go down transiently. Their BNP is normal. It does not respond to diuretics. For TACO, it is cardiogenic pulmonary edema. Their temperature does not change. Their blood pressure goes up. Their white blood cell count does not change. Their BNP goes up, and it does respond to diuretics. So for TACO, we can give them something like Lasix, and it can help treat it. For TRALI, it is supportive therapy only. Most TRALI patients end up on a vent. Please keep in mind patient population considerations. Religious concerns such as Jehovah's Witnesses. Please do not assume that because a patient is a Jehovah's Witness, they are going to refuse blood products. The offer needs to be made. They need to receive informed consent. In transplant patients, you need to consider the need for irradiated and or cytomegalovirus negative blood products. You need to consider the rate of infusion based on age, product, and medical condition. And in patients with congestive heart failure, large volumes transfused, or elevated BNP, you need to watch the rate that you're giving that blood and watch them for signs and symptoms of TACO in particular. As always, you can always reference our policies to determine how to properly give blood products, monitor for transfusion reactions. You can also reference Joint Commission standards related to blood and blood products.